So Nick Daniel. Okay, date of birth age 68. So go through the case notes 1 minute. Okay, so here is the letter. We are going to start. So write a letter, okay, and is ready for discharge. Refer to local physiotherapist. Refer to local physiotherapist. Okay. Refer to local, so reference. So discharge plan, refer to local physiotherapist. So you are writing to a physiotherapist. So that is a local physiotherapist. So refer, so it's a reference letter. It's after discharge, you are referring to a local physiotherapist. That is it. So this is a reference letter. Okay, fine. Good. Okay. Right. So Joel Ortner, I don't know what is this show they're doing here. Write a letter to Joel Ortner, physiotherapist in City Med Physiotherapy, 8 Albert Street, Dubbo, New South Wales. Okay, 6 lines. So it is 6 lines. Okay. So there are 6 lines here. Okay. Now let us see the 6 lines. Right. So you are writing to Mr. Joel Ortner. You know it is Mr. because you are writing to Joel. Joel is a male name. So Mr. Joel Ortner. Next line will be physiotherapist. physiotherapist. Then it is City Med Physiotherapy. Then it is 8 Albert Street, full form. Then it is Dubbo. Then it is New South Wales. NSW means New South Wales. New South Wales. Okay, you should know that. Okay, fine. And because most of the time you will get these words NSW or like that. So you have to remember this is the address. You got it. Okay. So Mr. Joel Ortner, Mr. Physiotherapist, City Med, C capital M capital Physiotherapist, City Med Physiotherapy, 8 Albert Street, ST in short. So Street, Dubbo, New South Wales. Okay, NSW stands for. You should know what is NSW. So I'm going to show you what is NSW here. NSW. NSW stands for. What is NSW stands for? NSW stands for New South Wales. NSW stands for New South Wales. Okay. NSW stands for New South Wales is an Australian state. It is an Australian state. NSW is New South Wales. It's an Australian state. That's it. Australian state. Okay, fine. So I think you got the clear picture now. Control C. Okay. Next. Right. What's this letter? Okay. Okay. Now let us see what you have written here. Mr. Joel Ortner, right? The physiotherapist. Physiotherapist is enough. Okay. The physiotherapist, the is not necessary because it is after a name. Okay. So no need. Before you can use the physiotherapist, Mr. Joel Ortner, but after Joel Ortner, no need the. And then the City Med Physiotherapy. There is the here physiotherapist in City Med of Physiotherapy. That's all. The is not there. Not necessary. Okay. This is not necessary. Okay. City Med Physiotherapy. That's fine. 8 Albert Street. Very good. Dubbo. NSW. You can write New South Wales. Okay. Dubbo is correct. In New South Wales, you can write down. You can write down New South Wales. Okay, if you don't know, you can just write NSW, no problem, but write at the next line. New South Wales.
So in case if we don't know the full form, just we can write NSW.
Write that only NSW.
Okay, and most of the time, like this hospital name and all that, we used to write like the community health center, the City Med Physiotherapy.
It's a particular one. Okay, the means particular one. Is it only one? then you can write. But in the address, it is not necessary. Okay.
Okay, if it is address, it is not mentioned, so no
Not
need to
particular.
write.
Okay, here Albert Street is only one and only, so the Albert Street is not needed. Okay.
Okay.
So when we know that it is only one and only, you need not write here. Okay.
Okay.
Next one. 26 July 2019. Okay. Date is okay. Format. Dear Mr. Ortner. Right. Regarding Mr. Nick Daniel, age 68. Right. I am referring Mr. Daniel. Never use. Many people will say in the official letter they are giving. In the official letter, they will not give A-class letters, okay, as samples, because nobody can understand. So they will give only medium-sized letter, medium quality letter, so that everyone can understand. Just pass quality they will give. Okay, they will not give excellent ones. So I am referring. Don't use I am referring. Why should you write? Anybody can refer. So you are not important here. Okay, so never write I am referring. So Mr. Daniel, comma, Mr. Daniel, comma, who has been discharged after hip replacement. Where is he discharged? He is not discharged. He is being discharged today. He is not discharged. He is being discharged. Okay. So discharge plan. So now he is being discharged. See here. So Daniel is a patient in the ward. He is a patient in the ward. He is in the ward. You are writing. You work as a nurse in the orthopedic ward, Roland Hospital. Okay, here you have the address, your address. What is your address? You are a nurse. So you can say registered nurse. And then you can say orthopedic ward. Then Roland Hospital. Roland Hospital. Okay. So this is your address. Registered nurse, orthopedic ward, Roland Hospital. This is your address. So you are a nurse, orthopedic ward in Roland Hospital. Okay. So this is your address. So this address will go here. The last. Okay. Right. Registered nurse. You have done it very well. Yours sincerely. Comma should be immediately. If you want to put, you put immediately. No space in between. No space in between. Registered nurse. Right. Orthopedic ward. PAE is better. This is also correct. Roland Hospital. Correct. Okay, you have done it well. Here sincerely. Okay. So here you can write last sentence like this. In case any additional information is required, kindly do not hesitate to contact me. That is better. In case any additional information is required, kindly do not hesitate to contact me. This is better for you. Okay. Any additional queries? Why should you leave any queries? If you write, if you want any queries, if you have for further queries, that means you did not inform clearly. So what you have to do is any additional, what all is required, I gave you. So still, if you need anything, you contact me. That is the meaning here. Don't keep the fault on your side. So if you write like this, that means you have still left chance for query. That is the meaning. In view of the above. Okay. Okay. Saying that is correct only based on the aforementioned circumstances. Okay, or based on the above mentioned circumstances, you can say. Based on the aforementioned circumstances is an even better one. So these are small words, these are bigger words. Okay, these are bigger words. Based on the aforementioned circumstances, requesting to teach Mr. Daniel different weight-bearing exercises. Okay, educating. Okay, education regarding weight-bearing exercises. So requesting to teach. Why requesting to teach? Who is requesting to teach? This is incomplete sentence. Sangeeta. Hello,
Yes, sir.
Sangeeta.
Yes, sir.
Do you want perfect feedback or do you want ordinary feedback or very simple feedback?
Perfect feedback.
Okay, then I am giving you that one only. Okay. So,
Okay.
based on the aforementioned circumstances, requesting to teach instead of that one, you can say education regarding different weight bearing exercises is recommended. Like that, you can say. So, here you can say, based on the aforementioned circumstances, comma, education regarding different weight bearing exercises. Education is required. Education is recommended regarding different weight bearing exercises is recommended or is advised. Okay, like that you have to write. Based on the aforementioned circumstances, education regarding different weight bearing exercises is advised. So like that you can write. As he is prone for dislocation, advise him how to use it. As he is. Avoid this he, Mr. Daniel, all this is. Avoid that as far as possible because we know there is only one patient. Why do you always want to say he? He will not become she here. So Mr. Daniel, we only know Mr. Daniel, it will not become Mr. Abraham. Okay, only one patient is there. We already told the subject is here. Mr. Daniel is here. Mr. Nick Daniel is only the subject regarding, that is what it is. So no need to say Mr. Daniel again and again and again. Okay. Your letter is very lengthy, I think. How many words it is, you have to count. Okay. So if it is more than 250, it will be a problem for you. So 200, maximum 210. Okay, that's okay, 210. Not more than that. Okay. As he is prone for a dislocation, advise him how to use the walker and crutches. Okay. So how to advise him how to use. So education regarding the same continue, you can continue here. Education regarding weight bearing exercises and the usage of walker and crutches. You can write there only. So where is it? So based on above circumstances, education regarding different weight bearing exercises. Okay. In addition to the usage of a walker and crutches. Full stop. Is advised, we can put it forward now. Okay, education is advised. Education regarding different weight bearing exercises in addition to the usage of a wheelie walker and crutches is advised. Education is required regarding different weight bearing exercises. So is required, we can put in the end also, is recommended. So now you understand, either you can write like this or you can write like this, is recommended. Okay. So education regarding different weight bearing exercises in addition to the usage, or you can say and the usage of a walker and crutches is recommended. So here education is recommended. You have to remember that. After recovery, please suggest proper way of using the stairs, following safety precautions. Following safety precautions. Why all these too much things? Okay. After recovery, please suggest the proper way of using the stairs, following safety precaution. After recovery, okay, I don't think this is that much important, because what is now is more important. Okay, you are writing too much. Okay, after recovery, please suggest proper way of using the stairs. And there only you can write usage of a walker and crutches. So here you can put a comma if you want. Bearing exercises, comma. Okay, remove this in addition to, comma. The usage of a walker and crutches, comma, and using the and stairs after recovery. Okay, you can say like this. Okay, is recommended. Education. Okay. Education regarding different weight bearing exercises, comma, the usage of a walker and crutches, and using the stairs after recovery is recommended. So like this, you can separate, or you can write two different sentences, or you can write one sentence here.
And again, sir, it is using, usage and using, it is twice
So you can
repeated.
change that one. Otherwise, you can say walker. Here you can join this one. Very good. You can join these two things. Usage of a walker, crutches, and the stairs after recovery. And the stairs after recovery is recommended. So this is recommended. Control C. Okay, education is recommended regarding different weight bearing exercises. Okay. The usage of a walker, crutches, and the stairs after recovery. And these are plural, so no, a singular, a walker. Right. So you have to next one. Now let us go forward. I am referring, so this is, I am referring Mr. Daniel, who has been discharged. Not been discharged, who is being discharged, or who is ready for discharge today. Okay. Right. Now here, comma should come here. Mr. Daniel, comma. So who has been recuperating? You can say who has been recovering, or who underwent hip replacement surgery. Who underwent hip replacement surgery, or when you write surgery, A is not needed. Okay. So which hip replacement? Right hip replacement. We don't know whether it is total or not. It is not clear. So after right hip replacement surgery, who has been recuperating from, who underwent or who has been recuperating from, okay, or who has been recuperating after, okay, recuperating from, so after remove. Okay, right hip replacement surgery.
Sir, excuse me, they used to tell that if it is surgery. Sorry, if it is surgery, they usually tell we have to write after, and then if it is any disease condition from. Is that true?
1 second, I'm coming. So, comma, okay. Yeah, tell me now.
Now, usually for the disease condition like pneumonia, those kind of things, we usually write disease condition from, isn't it? And then if it is surgery, we use after.
Okay. So, but you are discharged after hip replacement surgery, that is okay. Okay. Who is being discharged after hip replacement surgery, that is okay. That situation. But recovering from surgery, right?
Okay.
Okay, recovering from or recovering after, both are correct. That is not a problem. Okay. Recuperating after, okay, and from also, both are okay. Is that clear?
Yes, sir.
Recovering will be only after the surgery, no?
Yes, yes.
And recovery from the surgery only, no?
Okay.
Right? So, discharge after also is correct. But who has been discharged is not being discharged now, is being discharged, not finished. You written as it is completed.
So is being discharged, we can write.
Is being discharged. No, wait. Who has been recuperating from right hip replacement surgery, comma, here requires. So you are referring, is being referred, you can say. Is being referred, for means requires, okay. For means required, okay. Okay, we are not bothered about discharge here. We are bothered about a referral letter here. Is being referred, okay. For, is being referred for. This is a referral letter, right?
Yes.
You got it? This is a referral letter. See here what he's telling. Write a referral letter. So discharge plan is referred to local physiotherapist, and you are writing to a physiotherapist. You understand now?
Yes, sir.
Okay. So this is a discharge letter here. Is being referred for. Okay. Is being referred for support and assistance to recover and regain mobility. Recovering. Already this has come here. Recuperating, recovering. So you can avoid this one. Okay, to regain mobility. Okay, complete recovery, you can say. To regain, you can say. To regain mobility. Okay, so here you can say, so request him to teach Mr. Nick Daniel how to walk with a walker or crutches, and do not do weight bearing exercise, and use the stairs safely after full recovery. These are the things. Okay, so to provide education and support. Fine, that's good. Right. Regarding, okay, is who has been recuperating from right hip replacement surgery, is being referred for support and assistance. You can also add education here, because as I can teach him. So education. When you say teach him education, you can also say education, support. Support means assistance. So why two things are same? Support and assistance both are same. Correct?
Yes, sir.
Support means what? Assistance means what? Supporting means providing assistance. Providing assistance means supporting. Correct or not?
Sir.
They both mean one and the same. So you can say education and support. So bring out an education here. Necessary education. Necessary education and appropriate support to regain regain mobility. So like that you can write. Is that clear now?
Yes, sir. Yes, sir.
So I am referring, remove that. Mr. Daniel, who has been recuperating from right hip replacement. So remove surgery, a right hip replacement or right hip replacement surgery, comma, is being referred for means requires. That's why you are referring. You are referring because he requires. Is being referred for necessary education and appropriate support to regain mobility. Full stop. 2 months ago, Mr. Daniel presented to us. Is it necessary to us? Avoid personal pronouns as far as possible. 2 months ago, Mr. Daniel presented with the complaint of severe pain. Presented with the complaint of
So I have a doubt. This the complaint we write because previously I remember somebody corrected me not to use the complaint.
See, if there, see here, there are a limited number of complaints which he is using, right?
Yes.
So they are perfect full complaints with the history of all the complaints you are writing. Then if it is everything, then you have to write. If it is one and only, you have to say the. Okay. If you are writing 2 or 3 of them, then you have to say just a complaint of. If this is the only complaint, you have to say complaint. Okay. The
so
complaint.
two, three complaints of or complaint of, even though if it is two,
the
three.
Complaints of.
Okay.
Many are there and you cannot write everything, then you don't write the, because they are not everything, right?
Okay, still confusion.
There are 6 or 7 complaints and you are writing only 2, then just write complaints.
Okay, with the complaints. Okay.
If there are only 3 and you are writing all the 3, then you say the complaints. If it is only 1 complaint and you are writing 1 complaint, the complaint of, because here is only 1 complaint you are telling, right?
Yes, so the complaints.
With the complaint of severe pain in the right hip. How many right hips do you have?
1.
Only 1. So compulsory the, na? The one and only, then the definite article, na?
Okay.
When it is one and only complaint, then you have to say the complaint. When it is only 1 right hip, then you have to say the right hip. Okay.
Okay.
The right hip and knee. Okay. That means both the right hip and the right knee. That is the meaning here. Both are one and only. The right hip and the right knee. Okay. Resulted in decreased internal rotation and flexion of the right hip. Only hip. Then what about knee?
I have mentioned.
So there is a little bit confusion here, right? So you had severe pain and resulted only in the right hip, not in the knee. You got my point?
Yeah, that's how they mentioned that.
So it's not mentioned, means then you can be careful there. What you have to be selective. Okay.
Okay.
Right. In the right hip and the right knee, which resulted in decreased internal rotation and flexion of the right hip. The right hip. Whenever body part is there, you have to write the. Decreased internal rotation and flexion of the right hip. The X-ray, which was ordered, very good. Very good. You have written very nicely, but commas are missing. The X-ray and which means the one and the same. The X-ray, which was ordered, again here comma. So the X-ray was ordered. If you take the central part, the X-ray was ordered, and here the X-ray revealed degenerative changes consistent with osteoarthritis in the right hip. The right hip, okay. The right hip. Whereas is one word. Why did you write 2 words? Whereas is one word. Whereas, that is it. You have to write like that. Whereas, X-ray of the right knee was normal. If it is normal, why did you write that? This is no need to, this sentence is not at all necessary here. If there is a problem, you have to write. If there is no problem, why you will write? For example, you will go to the doctor and you have cold, you have, okay, you have temperature, blood pressure, all these things. You have only blood pressure. You have blood pressure. Okay, there you will go. My temperature is normal. You need not say. I have high blood pressure. That you tell, no? You tell only about your problems. I have no cold. I have no cough. I have no fever. No need to tell everything. You just say one thing. I have high blood pressure. Finished. Do you understand what I am talking?
Yes, sir.
See, when you don't have any problem, why are you bothered? I don't have eyesight. I don't have back pain. I don't have headache. There will be too many things which are normal. Why do you want to talk about them? Are you able to follow my points here very clearly?
Yeah, because what I thought is he has problem in the knee also, no? So maybe the person should know what the X-ray revealed.
Okay. So here it is normal. So that is very clear.
Exclude it.
So you should not have written about the knee here. Severe pain in the right knee. Okay. So separate that one. There only I told you there is something wrong. I know that you will get it here. You got it?
So only mention the right hip.
Talked only regarding the right hip.
Okay.
Which resulted in decreased. So of the right hip, then no need. So you would have eliminated all these things. So don't write about knee here. Don't write about knee here and finished. No need of hip bigger. Because you wrote knee here, then you had to write hip here. Okay, now see here. 2 months, 2 months or months. Oh, I missed this one. 2 months or months. 2 months ago, Mr. Daniel presented with the complaint of severe pain in the right hip, resulting in, or which resulted in, or resulting in decreased internal rotation and flexion. That's enough. Why again right hip? No need now. And next, you have to say, though the pain persisted in the right knee, X-ray was normal. So that is different totally. You could have separated those two things. Now you understand?
Yes, sir.
You got the point clear?
Yeah,
so
what it told?
Avoided that right hip there.
Okay.
Right. X-ray of the right knee was normal. Therefore, he was commenced on. Therefore, he was commenced on. He only, not you, not the doctor. He only, we know that. And he is Mr. Nick Daniel only, nobody else. So why he again? So he was commenced on. Remove. Therefore, okay. Whereas X-ray of the right knee was normal. Therefore, because it was normal, he was commenced on indomethacin. What do you mean by that? Don't you know what you are doing there? Huh? He made a problem there, correct? If it is normal, why you are commencing indomethacin? You tell me now.
Now he has that right problem, no? So that's the reason. Both
Yeah,
together.
that you have to separate. No, why did you put a comma, colon and write there immediately?
Okay.
Okay. So you should have written degenerated changes consistent with osteoarthritis in the right hip. There you could have written, that would have been better.
Okay.
Correct or not?
Yeah.
You got it?
Yeah. So exclude that right knee problem and
you could have written separately
continue.
that one. You join with that one and you are telling therefore he was commenced. Because he has degenerative changes with the osteoarthritis in the right hip and right knee was normal. Therefore, he was coming. So you are creating some sort of confusion. This commencing on indomethacin is related to the degenerative changes consistent with osteoarthritis in the right hip. There you should have put that one, correct?
Okay.
This indomethacin is for what?
So for the right hip pain.
For that one you have to put there, no?
Yeah. So I will.
After that.
Okay.
Okay.
Right hip and then therefore.
You are saying normal and you are writing this one. Otherwise, you would have written normal things before. Actually, you no need to write that one. Okay. Next one, following a month. Here you are writing 2 months ago and you are saying following a month. Okay. Okay. So here, 2 months ago, why did you write 2 months ago? The date was not given.
Date was there.
Date was not given. You should have written the date. You should have written the date better. Na?
Okay.
Now here there is a confusion. 2 months ago and following a month. What is this confusion here? You could have given the date there. With severe pain in the right hip. Okay, very severe pain in the right hip.
First.
2 month history, severe pain in the right hip and knee. Okay, 5 years of trouble with right hip. Okay, see here, 5 years of trouble with right hip. Pain in the knee is there, but problem is with the right hip. So on 13/5/2019, here you are writing 2 months ago. Why you are writing a vague idea? When the correct date is there, why are you not using the date? Date is more perfect, na? Correct or not? When were you born? In which month were you born? Tell me.
January.
In which month were you born?
January.
January. I was born in January. You know the date, no? Which date?
19th.
19th January. My birthday is on the 19th of January. My birthday is in January, which is perfect, or my birthday is on 19th of January? Which is better? You tell me.
On 19th of January.
That means it's a very clear, no? Clarity. You understand? Half you are hiding. Something is perfect with the date and you are blindly saying 2 months ago. 2 months ago means when? When was that? Why are you giving a vague idea when perfect idea is there? So you hear it is there, 13 May 2019. On 13 May 2019, Mr. Daniel presented with, now you understand?
Yeah.
This is very perfect. Now here you can write next one. Okay, so this is 13/5 and 12/6. On 12th June. Here you can write on after 1 month you can write on 12th June, no need again 2019. So this is 2019 already there. So here also no need 2019 because already date you mentioned.
Okay.
You understand?
Okay.
Date is already here 2019, same year, then you need not write again year. If the year is different, then you can write year, okay?
Okay, sir.
Once you write year, don't repeat the year.
Okay.
Until and unless the year changes. That means you are in one particular year, the same year. Finished. There is no need to repeat time and again. So, next one. Right. After a month or a month later or on 12 June, Mr. Daniel returned to the clinic. Okay. With a severe pain due to worsening of arthritis, osteoarthritis in the right hip. He was advised to restart indomethacin. He was advised to restart indomethacin. Okay, he was advised. Why you want to say he was advised? Okay, to restart. So, okay, restart indomethacin was advised. Restarting indomethacin was advised. Okay, recommencement of indomethacin was advised. Or indomethacin was recommenced. Finished. Which he had stopped without consultation, without the consultation of the physician, without consultation without any consultation with the physician. Okay, consultation without consulting the physician. Without consulting the physician. Okay. So that's it.
So can you repeat that sentence again?
Repeat means no need again. Repeat means means again only. Okay. Repeat the sentence or tell the sentence again. Repeat again is wrong. Okay.
Indomethacin was
Mr. Daniel
recommended.
returned to the clinic with severe pain. Okay. So return to the clinic. To the clinic is not needed. Why so many times to the clinic? He came to the clinic only. You are there in the clinic only. Why to the clinic again and again? No need. Mr. Daniel presented or returned, okay, or during the following visit on 12th June, during the next visit on 12th June, severe pain due to worsening osteoarthritis was reported. Finished. Okay. During the next visit on 12th June, is it clear now?
Yes, sir.
During the next visit on 12th June, why do you want to write Mr. Daniel every paragraph? I don't know who is telling you all these things. During the next visit on 12th June, even if you don't write Mr. Daniel, we know that there is only one patient. He only visits there. During the next visit on 12th June, worsening osteoarthritis. Severe pain means severe pain. Earlier also pain is there. Severe pain, worsening osteoarthritis. Okay. Right. Worsening osteoarthritis. Okay. Right. Severe pain due to worsening osteoarthritis. Severe pain due to worsening osteoarthritis was reported. That means he visited again, next visit only. During the next visit on 12th June, severe pain due to worsening osteoarthritis was reported. Is that clear?
Yes, sir.
So simple as that. Why Mr. Dan? Why are you pulling Mr. Daniel again and again and again? Okay. And therefore, indomethacin, which was stopped without consulting the physician, was recommenced. Finished. So right, that's it. Was reported, and therefore, indomethacin, which was stopped without consulting the physician, okay, indomethacin, okay, and therefore indomethacin, which was stopped without consulting the physician, was recommenced. Is that clear now?
Yes, sir.
That is simple, so simple as that one. You pulled so much. You understand now?
Yeah.
why your essay letter is going so big? You understand?
Yes, sir.
Simple things, you're making it a bubble gum. Okay. There is no he, there is no Mr. Daniel, there is nothing. Okay.
Yes, sir.
So that's it. Already you told osteoarthritis of the right hip. So again, why you need to write of the right hip? You understand? You got it?
Yes, sir.
Because right knee was normal, you are telling, na?
Hmm.
You already know that it is the right hip, not the right knee here. Correct? So no need to repeat osteoarthritis in the right hip, osteoarthritis every time. Finished. Worsening osteoarthritis. Finished. Next one. Despite of. Ayo. Despite means itself in spite of. In the word despite, you have three words. In spite of. Is that clear? Despite is equal to in spite of. You understand now?
Okay, off should not be there.
So off is already there in despite. Is that clear?
Yes, sir.
So say despite medication, Mr. Daniel's pain increased. What do you mean by despite medication or despite medication compliance or whatever it is? You can write despite medication compliance maybe. So despite medication, Mr. Daniel's pain increased. So why Daniel again? Why do you want to use Mr. Daniel again? No need. Despite medication, pain increased. Finished. Whose pain? Your pain or my pain or somebody's pain? No, Mr. Daniel's pain. How many patients are there? How many people will face pain in this letter? Tell me. Sangeeta, tell me.
One only.
Can you not understand that it is Daniel's pain only? And pain in the right hip only, correct or not?
Yeah.
And related to osteoarthritis only, everything is understood. Consequently, decreased muscular mass and range of movement in the right hip. Okay. We are talking already about the right hip only. Why again right hip? Why again right hip? Huh? We have all these things in the right hip only, no?
Hmm.
Why are you writing so many times right hip, right hip, right hip? We know that the problem is the right hip. Correct or not?
Okay.
And that is what is replaced, right?
Yes.
We are not talking about anything. The entire lecture, the entire letter is regarding right hip replacement. Correct or not?
Yes, sir.
Then why are you telling every time right hip, right hip, right hip? That I don't understand. That is what is increasing your word count. Okay, decreased muscular mass and range of movement. So two things are there. Decreased muscular mass and decreased range of movement. Two things are there here.
Yeah.
Okay. Decreased A and decreased B were observed.
Okay. Two
You
things are
understand?
there. Yes, yes.
Or decrease in the muscular mass and the range of movement was observed. Then you can say decrease was observed. You understand? Therefore, comma.
No, you said consequently, there was decreased muscular mass and range of movement.
Therefore, decreased muscular mass and diminished or reduced range of motion were observed. Decreased muscular mass and reduced range of movement
Okay.
were observed. Therefore, he underwent surgery on 19 July 2009. 19. Mr. Daniel is a retired farmer who is married and lives with his wife and son. He has had type 2 diabetes and is allergic to penicillin. Penicillin spelling, you don't know the spelling of penicillin? P-E-N-I, penicillin, as well as intolerant to and is allergic to penicillin, as well as, I don't understand the sense here. He has had type 2 diabetes and is allergic to penicillin as well as lactose.
Intolerance.
As well as, when you say, you have to use allergic to this also. Otherwise, you use and. He is allergic to penicillin and intolerant to lactose.
And so many and
as
comes.
Well as, it applies to both.
Then so many and comes in one sentence, sir.
So you change, na? Separate, break it into two. Okay? Make it separate sentence then. Yeah,
So,
you are thinking wisely. Okay, this only one letter, you cannot become perfect. In the future, you will slowly you will improve. Okay. Okay. Next one. Mr. Daniel has been progressing well after the procedure. Okay. Why Mr. Daniel again? I don't understand. The post-operative recovery. Excellent progress during the excellent post-operative has been observed. Excellent post-operative progress has been observed, noticed. Okay. Excellent post-operative progress has been observed or noticed. Is that clear?
yes, sir.
Post-operatively, excellent progress has been observed. That is enough. Is that clear? Okay. Okay. Fine. So next, right. So post-operatively, excellent progress has been noticed. That is enough. Or excellent post-operative progress. So you can say post-operatively. You can write like that also. Okay, excellent progress has been observed or noticed. Okay, well after the procedure finished. Okay, post-operatively, procedure means post-operative finished. Even though is one word or two words. I know although is one word, but even though is one word or two words, tell me. Sangeeta, do you have any idea? Okay, now let us see. I am taking you to Cambridge Dictionary. Although is one word. That's very clear. But what about even though? Let us see. Even though. Is it showing anything? No. It's showing it's a mistake. Now this shows. Is that clear now? Sangeeta, is that clear? So
yes, sir.
even though is two words. Even though are two words. So better next time careful. Because if you don't know, it's okay, no problem. Nobody is hurting us, but in the exam it will hurt. Okay, even though, 2 words, even though. Instead of that, why you want to waste 2 words? You can just write although. One word is enough. Okay, if you have already written, then okay. Even though physiotherapy was commenced, no need comma after even though. Even though physiotherapy was commenced, post-operatively, however, when you used even though, why are you using however? So use any one, even though or however, any one is enough. Discomfort was noticed in his right hip area. Again, why right hip area? How many times you want to say? Huh? Why do you want to say right hip, right hip, right hip many times? Okay. That's what it is. Be very careful. Even though you are duplicating words, that is the problem. Unnecessarily repeating the words. Even though, then no need of however. And see here, although is one word enough. Although one word is enough, you wrote even though 2 words. And after writing even though 2 words, you are using another word, however. That means it's duplication. Just one word, although suffices. Okay, then in his right hip area, how many times you have written this one? Okay, so that is it. We have done with everything. I hope it is clear. Okay, now tell me, Sangeeta. Hello, Sangeeta.
Yes, sir. Tell me.
How was the feedback? Your head is gone. Yeah, share your experience. What do you feel regarding the session now? Hello? What happened?
Yeah, sorry. I think it muted.
Yeah, come on, come on.
It makes a lot of difference than individual correction and just correcting and sending, because each word by word we know what is the mistake.
Yeah, you have to come to that level, no? So that's why I was waiting. You understand now?
Yes, sir.
Now I am hitting it hard. Till now I gave you ordinary. Now I am going to give you serious ones.
Yeah.
So this is not a joke. So now tell me, do you want to improve?
Of course.
Yeah. Now make all the changes, limit it to 200 words. 205, 210, maximum 210 is okay. More than that, not wise. Okay.
Yeah.
Right.
The repetition, if I remove, then for sure, I think I can.
Yes, definitely. Okay, then have a nice day. Bye-bye.
Thank you.